So the next fixative is gluteraldehyde. In previous lecture we have discussed about the picric acid and their function, how we can use in histopathology lab. The next one is gluteraldehyde. So in that video lecture we will discuss about briefly about the gluteraldehyde fixative, so that we can decide either we have to use it in our laboratory or not. So as we know, that is a huge topic, but in that video lecture I just brief some important points so that we can understand and remember easily all the points. So the first is, what is gluteraldehyde? So basically it's a chemical that used to preserve the tissue as the other fixative do, especially for what? Electron microscopy. And it has, as the name suggests, it has aldehyde group, so it has two reactive ends that help lock proteins in place. Now we also have another fixative, that is formaldehyde. So how it is different from the formaldehyde? Now let's see. It works like formaldehyde but has two reactive parts. One part stays unused, that can cause the false negative result like in a patch stain. So these tests can't be used on the tissues fixed with the gluteraldehyde. If a tissue is fixed in a gluteraldehyde fixative rather than the formaldehyde fixative, so it can cause the false negative result. That's why we can't use it for some tests like patch reactive test. The next one is, how does it work? As we know that it enters the tissue slowly and starts working right away. Because it does not go deeply, tissue slices must be thin. As we know that it can make tissues too hard if left too long, so use it for around 2 hours or less then move to the tissues to a buffer. In simple, we can say that it makes the tissue hard, so we can't use it, and it can also cause the false negative result. That is another reason we don't have to use it in our lab. The next is when it is used. Mainly used for electron microscopy, as I have previously discussed. For what? To see very tiny cell details. But it's not good for light microscopy because it hardens the tissue too much and does not go deep enough. So here are some points that have discussed about the gluteraldehyde. Now let's see what are the safety measures and the precautions, and how can we store it in our labs. So how can we store it? As we know that it breaks down if exposed to the air and the light. So always use fresh solutions. Keep it cold in a fridge, and also mix it with the special buffers that the pH around 7.2 to 7.4 to make it stable. The safety concern that are also important, it can cause the irritation to the eyes, skin and lungs. As we know that it's like a formaldehyde, so should be handled with gloves, mask and ventilation. The buffers that are used for their preparations with arsenic like cacodylate can be toxic. So here are some important points about the gluteraldehyde. In that video lecture we have discussed it's a chemical that has two aldehyde groups. It can be used for electron microscopy, not suitable for light microscopy. The next is, as it doesn't go deeply, so we have to use the very thin slices. It can cause irritation, so handled with the care. So that is all about the gluteraldehyde.